What motivated you to specialize in dermatology nursing?
I was motivated to specialize in dermatology nursing because I saw how much skin conditions affect both physical comfort and emotional well-being. Early in my nursing career, I worked in a general medical ward where I regularly cared for patients with chronic skin problems such as eczema, psoriasis, infected wounds, and pressure ulcers. Many of these patients felt embarrassed, anxious, or frustrated because their conditions were visible and long-lasting. One particular experience involved a middle-aged patient with severe psoriasis who had been admitted due to secondary infection. He was withdrawn and avoided eye contact, and he often refused treatment at first. I realized that managing his condition was not only about applying medication, but also about building trust and explaining care in a respectful way. I took time to educate him about his treatment plan, involve him in daily skincare routines, and coordinated with a dermatologist to adjust his therapy. Over 2 weeks, his skin condition improved, and he became more confident and cooperative. This experience showed me that dermatology nursing allows nurses to make a meaningful difference through patient education, long-term care, and emotional support. I enjoy the detailed nature of skin assessments and the opportunity to help patients regain comfort, confidence, and quality of life.
Can you describe your previous nursing experience and how it relates to dermatology?
I have worked as a registered nurse for several years in medical and surgical wards, where I gained strong clinical skills that are very relevant to dermatology nursing. In my previous role in a medical ward, I regularly cared for patients with skin conditions related to chronic illness, immobility, diabetes, and infections. This included managing pressure injuries, leg ulcers, surgical wounds, and inflammatory skin conditions. One example involved caring for elderly patients at risk of pressure ulcers. I was responsible for daily skin assessments, wound dressing changes, pain management, and repositioning schedules. I worked closely with doctors, physiotherapists, and dietitians to prevent further skin breakdown. By monitoring skin integrity closely and educating patients and families, we reduced the number of severe pressure injuries in the ward over a 3-month period. I also supported dermatology clinics by assisting with skin biopsies, patch testing, phototherapy preparation, and patient education on topical treatments. I learned the importance of infection control, accurate documentation, and patient compliance in long-term skin care. These experiences helped me develop strong observation skills, patience, and confidence in managing complex skin conditions, which directly relate to the demands of dermatology nursing.
What do you think are the key responsibilities of a dermatology nurse?
I believe the key responsibilities of a dermatology nurse focus on providing safe, effective, and compassionate care for patients with a wide range of skin conditions. One important responsibility is performing thorough skin assessments. This includes identifying changes in skin condition, recognizing signs of infection or deterioration, and reporting concerns promptly to the medical team. Accurate documentation and close monitoring are essential, especially for patients with chronic or complex conditions. Another major responsibility is delivering and assisting with treatments. In my previous role, I regularly prepared and applied topical medications, supported wound care, assisted during minor procedures such as biopsies, and ensured correct use of phototherapy equipment under supervision. I followed strict infection control measures to protect patients and staff. Patient education is also a key responsibility. Many skin conditions require long-term management, so I spent time explaining treatment plans, demonstrating correct application of creams, and advising on skincare routines and trigger avoidance. Emotional support is equally important, as visible skin conditions can affect confidence and mental health. By listening to patients and addressing their concerns, I help them feel supported and involved in their care. Finally, teamwork and communication are essential. Coordinating with dermatologists, pharmacists, and other nurses ensures consistent, high-quality care and positive patient outcomes.
How do you stay updated on dermatology treatments and skincare advancements?
I stay updated on dermatology treatments and skincare advancements by actively using a combination of learning, observation, and professional engagement. While working in a medical ward that often received dermatology referrals, I realized that skin treatments change quickly, so I made it a habit to regularly review updated clinical guidelines and hospital protocols related to wound care, infections, and inflammatory skin conditions. I set aside time each week to read nursing journals, trusted medical websites, and evidence-based practice updates. I also learn a great deal through teamwork. When supporting dermatology clinics, I observed new treatment approaches such as biologic therapies, updated topical regimens, and improved wound care products. I asked questions during ward rounds and case discussions to understand why certain treatments were chosen and how they benefited patients. This practical exposure helped me apply new knowledge safely in daily care. In addition, I attend workshops, in-service training, and online courses whenever available. Recently, I completed a short course on chronic wound management, which improved my confidence in selecting appropriate dressings and educating patients. By combining formal learning with hands-on experience and reflection, I ensure my practice remains current, safe, and patient-focused.
What are common dermatological conditions you have managed?
In my nursing practice, I have managed a wide range of common dermatological conditions across medical, surgical, and outpatient settings. Many patients presented with chronic inflammatory conditions such as eczema and psoriasis. These patients often required long-term topical treatment, regular skin assessments, and ongoing education to improve adherence and reduce flare-ups. I supported them by monitoring treatment response, identifying triggers, and reinforcing correct skincare routines. I have also frequently cared for patients with skin infections, including cellulitis, fungal infections, and infected wounds. In these cases, I was responsible for observing signs of spreading infection, administering prescribed medications, maintaining strict infection control, and reporting any deterioration promptly. Early intervention often prevented complications and reduced hospital stay. Another area of experience is wound care. I managed pressure ulcers, diabetic foot ulcers, venous leg ulcers, and post-surgical wounds. This involved regular dressing changes, pain management, risk assessment, and collaboration with multidisciplinary teams. Over time, I developed strong skills in wound assessment and documentation. I've also assisted with skin cancer screening clinics, supporting procedures such as biopsies and patient education on sun protection. Managing these varied conditions strengthened my clinical judgment and reinforced the importance of holistic, patient-centered dermatology care.
How do you assess and document skin conditions accurately?
Accurate assessment and documentation of skin conditions are essential for safe and effective dermatology care. When assessing a patient, I begin with a systematic head-to-toe skin inspection, paying close attention to color, texture, temperature, moisture, and any visible lesions or wounds. I assess the size, shape, location, and appearance of the condition, as well as signs of infection such as redness, swelling, discharge, or odor. I also ask the patient about pain, itching, duration of symptoms, and any triggers or previous treatments. In one situation, I cared for a patient with a worsening leg ulcer. By measuring the wound weekly, noting changes in exudate and surrounding skin, and monitoring pain levels, I was able to identify early deterioration. I escalated this to the medical team, and the treatment plan was adjusted, which prevented further complications. For documentation, I use clear, objective, and standardized terminology. I record measurements, observations, interventions provided, and the patient's response to treatment. I ensure documentation is timely and accurate, often including photographs if permitted by policy. This approach supports continuity of care, improves communication within the team, and helps evaluate treatment effectiveness over time.
Can you explain how you assist with skin biopsies or minor dermatologic procedures?
When assisting with skin biopsies or minor dermatologic procedures, my role is to ensure patient safety, comfort, and smooth workflow before, during, and after the procedure. Before the procedure, I prepare the treatment room by checking equipment, sterile instruments, and specimen containers. I confirm patient identity, consent, allergies, and the procedure site. I also explain the process in simple language to reduce anxiety and answer any questions. During one clinic session, I assisted with multiple punch biopsies for suspected skin cancer. I supported the dermatologist by maintaining a sterile field, preparing local anesthetic, and handing instruments as required. I closely observed the patient for discomfort, bleeding, or anxiety and provided reassurance throughout the procedure. After the biopsy, I applied appropriate dressings, monitored for bleeding, and labeled specimens accurately before sending them to the laboratory. I documented the procedure clearly, including site, size, and patient response. I also educated the patient on wound care, signs of infection, and when to seek help. By following protocols and communicating effectively, I helped ensure safe procedures and positive patient experiences.
What is your experience with wound care and dressing changes in dermatology patients?
I have extensive experience in wound care and dressing changes for dermatology patients in both inpatient and outpatient settings. Many of these patients had chronic wounds such as pressure injuries, venous leg ulcers, diabetic foot ulcers, and post-biopsy or post-surgical wounds. Each case required careful assessment, planning, and ongoing evaluation. In one situation, I cared for a patient with a long-standing venous leg ulcer that had not improved for several weeks. I assessed the wound size, depth, exudate, and surrounding skin condition, and noted signs of maceration due to excessive moisture. I followed the prescribed treatment plan, selected appropriate absorbent dressings, and ensured correct application of compression therapy. Dressing changes were done using a septic technique, and pain relief was provided before the procedure. Over 4 weeks, I monitored progress through regular measurements and documentation, and communicated changes to the medical team. The wound gradually reduced in size, and the patient reported less pain and improved mobility. Through this experience, I developed strong skills in wound assessment, dressing selection, infection prevention, and patient education, which are essential in dermatology nursing.
How do you recognize signs of skin cancer, and what is your role in early detection?
Recognizing signs of skin cancer is an important responsibility in my nursing role, especially in dermatology and general clinical settings. I am trained to observe changes in the skin such as new or changing moles, non-healing lesions, irregular borders, uneven color, bleeding, or rapid growth. During routine skin assessments or dressing changes, I remain alert to any suspicious lesions and document them carefully. In one case, while caring for an elderly patient with a chronic leg wound, I noticed a small pigmented lesion near the wound edge that had irregular borders and had recently changed in color. I discussed my concerns with the patient and promptly reported the finding to the dermatologist. A biopsy was arranged, and the lesion was diagnosed at an early stage. Early identification allowed timely treatment and reduced the risk of further spread. My role in early detection also includes patient education. I encourage patients to perform regular skin self-checks and to report any changes early. I provide advice on sun protection and risk factors. By combining careful observation, clear communication, and patient education, I contribute to early detection and improved outcomes for patients at risk of skin cancer.
What infection control measures are critical in a dermatology setting?
Infection control is critical in a dermatology setting because many patients have broken skin, open wounds, or weakened skin barriers. One of the most important measures is strict hand hygiene before and after every patient contact. I always follow the 5 moments of hand hygiene and use appropriate personal protective equipment, such as gloves and aprons, depending on the procedure and risk of exposure. In my previous role, I worked in a dermatology clinic where several patients required wound care and minor procedures each day. To reduce the risk of cross-infection, I ensured all instruments were properly sterilized and that treatment areas were cleaned between patients. I followed a septic technique during dressing changes and procedures, especially for biopsies and infected wounds. Another key measure is proper waste disposal and safe handling of sharps. I also ensured correct labeling and handling of specimens sent to the laboratory. Environmental cleanliness was maintained by regularly disinfecting high-touch surfaces. Patient education is also important. I advised patients on hand hygiene, wound care at home, and recognizing early signs of infection. By consistently applying these measures, I help maintain a safe environment and reduce healthcare-associated infections.
What topical and systemic medications are commonly used in dermatology?
In dermatology practice, both topical and systemic medications are commonly used, depending on the severity and type of skin condition. Topical medications are frequently the first line of treatment. These include corticosteroids for inflammatory conditions such as eczema and psoriasis, antifungal creams for fungal infections, antibacterial ointments for localized infections, and emollients to restore the skin barrier and reduce dryness and itching. I regularly assisted patients by explaining the correct amount, frequency, and method of application to improve treatment effectiveness. In one clinic setting, I noticed several patients were not responding well to treatment because they were applying topical steroids incorrectly. I provided clear demonstrations and written instructions, which led to better symptom control within a few weeks. Systemic medications are used for more severe or widespread conditions. These include oral antibiotics for severe infections, antihistamines for itching, and immunosuppressive or biologic therapies for chronic inflammatory diseases such as severe psoriasis. While caring for patients on systemic treatments, I monitored for side effects, ensured blood tests were completed on time, and reported concerns promptly. Understanding these medications and supporting patients through education and monitoring helps ensure safe use and improves long-term outcomes in dermatology care.
How do you educate patients on proper use of topical medications?
Educating patients on the proper use of topical medications is essential to achieve good treatment outcomes in dermatology. I begin by assessing the patient's understanding of their condition and any previous experience with topical treatments. This helps me tailor the explanation to their needs and address misconceptions early. In one outpatient clinic, I supported a patient with chronic eczema who was using topical steroids inconsistently due to fear of side effects. I took time to explain the purpose of the medication, the correct strength, and how it helps reduce inflammation when used as prescribed. I demonstrated the correct amount using simple measures, such as fingertip units, and explained when and where to apply the cream. I also discussed the importance of applying emollients regularly and in the correct order. I encourage patients to ask questions and repeat key instructions to confirm understanding. Written information is provided when available, especially for long-term treatment plans. I also explain possible side effects and signs that require medical review. By using clear language, demonstrations, and reassurance, I help patients feel confident and more likely to follow their treatment plan correctly.
What are common side effects of dermatological treatments, and how do you manage them?
Common side effects of dermatological treatments vary depending on whether the medication is topical or systemic, but early recognition and management are very important. With topical treatments, I often see skin irritation, redness, burning, dryness, or thinning of the skin, especially with prolonged steroid use. When patients report these symptoms, I assess the affected area, review how the medication is being used, and check if the strength or frequency may be too high. I then report findings to the medical team and reinforce correct application, including treatment breaks if prescribed. In one case, a patient using a strong topical steroid developed increased skin fragility. After review, the treatment was adjusted, and I educated the patient on correct usage, which led to gradual improvement. Systemic treatments can cause side effects such as nausea, fatigue, infections, or abnormal blood results. While caring for patients on oral or injectable therapies, I monitored vital signs, blood test schedules, and signs of infection. I ensured patients knew what symptoms to report urgently. By combining careful monitoring, patient education, timely escalation, and clear documentation, I help manage side effects effectively while supporting safe and continued treatment.
Do you have experience with phototherapy or laser treatments? If so, describe it.
Yes, I have experience supporting patients undergoing phototherapy in a dermatology setting. I assisted in caring for patients with conditions such as psoriasis, vitiligo, and chronic eczema who required regular phototherapy sessions over several weeks. My role involved preparing the treatment area, checking equipment safety, and ensuring treatment protocols were followed accurately. In one clinic, I supported a group of patients attending phototherapy 3 times a week. Before each session, I confirmed patient identity, reviewed treatment doses, assessed skin condition, and checked for any new medications that could increase photosensitivity. I also ensured protective measures were in place, such as eye protection and genital shielding when required. After treatment, I assessed patients for side effects such as redness, itching, or burning and documented their response. One patient developed mild erythema after a session, which I reported promptly, leading to a dose adjustment and prevention of further irritation. I also provided education on skincare, sun avoidance, and the importance of attending scheduled sessions. This experience strengthened my understanding of treatment safety, patient monitoring, and clear communication in dermatology care.
How do you educate patients about chronic skin conditions and long-term care?
Educating patients about chronic skin conditions and long-term care is a key part of my nursing role, as these conditions often require ongoing management and lifestyle adjustments. I begin by understanding the patient's knowledge, concerns, and expectations. Many patients feel frustrated or discouraged because their condition is long-term, so building trust is very important. In one situation, I cared for a patient with long-standing psoriasis who had frequent flare-ups and poor treatment adherence. I explained the nature of the condition in simple terms, emphasizing that while it may not be cured, it can be well controlled. I discussed the importance of regular treatment, even when symptoms improve, and identified triggers such as stress and skin dryness. I provided practical advice on daily skincare routines, correct medication use, and when to seek medical review. Written information and follow-up appointments helped reinforce learning. Over time, the patient became more confident in managing their condition and reported fewer flare-ups. By offering clear explanations, emotional support, and consistent education, I help patients develop realistic expectations and take an active role in their long-term skincare.
How do you handle patients who feel embarrassed or anxious about their skin condition?
When caring for patients who feel embarrassed or anxious about their skin condition, my priority is to combine clinical expertise with sensitivity to their feelings. I recently cared for a patient who had a severe skin flare-up on her face and arms. She was very upset, avoiding eye contact and trying to hide her skin under the bed sheets whenever I entered the room. My goal was to apply her treatments while making sure she felt respected and comfortable. To help her, I always made sure the curtains were fully closed for privacy and spoke to her in a calm, kind voice. I explained that skin conditions are common and that we see them often, which helped her feel less different. While applying her prescribed topical ear drops and skin ointments, I used a gentle and confident touch. I made sure her skin was kept dry and protected after each treatment to help it heal faster. By the end of my 3-day shift, the patient stopped hiding her skin and was much more willing to talk to the medical team. This experience showed me that treating a patient's feelings is just as important as treating their physical illness to help them recover well before their follow-up visit.
How do you promote patient adherence to dermatology treatment plans?
Promoting patient adherence to dermatology treatments requires clear communication and a focus on making the plan easy to follow. I recently cared for a patient who was prescribed a complex routine involving oral antibiotics and multiple topical creams for a severe skin infection. The challenge was that the patient felt overwhelmed by the number of steps and was worried about the side effects of the medication. My task was to ensure she understood the importance of the treatment and felt confident enough to follow it correctly at home. To achieve this, I created a simple color-coded chart that showed exactly when to take the antibiotics and where to apply each cream. I sat with her and demonstrated the correct way to apply the topical treatments, emphasizing that her skin must be kept dry and protected to facilitate healing. I also explained how the antibiotics work to stop the infection from spreading, which helped her understand why finishing the full course is vital. We discussed her follow-up visits scheduled in 5 to 7 days, which gave her a clear goal to work toward. By involving the patient in the process and giving her written instructions she could easily read, her confidence increased. When she returned for her follow-up, her skin had improved significantly, and she had not missed a single dose. This experience taught me that patients are much more likely to follow a plan when they understand the why behind each step and have simple tools to help them stay organized.
Describe a challenging dermatology case and how you managed it.
One particularly challenging case involved a middle-aged patient admitted with a severe weeping eczema exacerbation covering over 60% of his body, complicated by a suspected secondary bacterial infection. He was in significant distress, sleep-deprived, and frustrated by previous treatments that had failed. The immediate clinical priorities were infection control, symptom relief, and breaking the itch-scratch cycle. I collaborated closely with a dermatologist and microbiologist. After obtaining swabs, we initiated systemic antibiotics and tailored a rigorous topical regimen. However, the key challenge was his profound discomfort and anxiety, which made consistent care difficult. To address this, I implemented a structured, timed approach. We scheduled cool, wet wrap applications every 4 hours, which I personally supervised for the first 24 hours to ensure technique and provide comfort. I integrated these sessions with timed doses of antihistamines and analgesics to maximize relief. Recognizing the psychological toll, I advocated for and facilitated an urgent review by our in-hospital clinical psychologist. Beyond direct care, I coordinated his environment, ensuring his room was kept cool and that he had access to cotton garments. I educated him on the purpose of each intervention, turning passive receipt into understanding. Within 48 hours, the weeping had significantly reduced, and his pruritus was manageable. After a week, his skin was healing, and he was independently performing his care. This case underscored that managing severe dermatological conditions requires a simultaneous, disciplined attack on the physiological pathology and a compassionate, educational strategy to empower the patient amidst a crisis.
How do you prioritize care when managing multiple dermatology patients?
Prioritizing care in a busy dermatology setting requires a dynamic system that balances clinical urgency with efficient workflow. I continuously triage based on acuity, treatment complexity, and patient-specific factors. My approach was tested during a particularly heavy clinic day where I was the primary nurse for a mix of 15 patients. These included a new referral for a rapidly spreading cellulitis, a patient due for their first biologic injection requiring extensive education, and several routine follow-ups for stable psoriasis. I began by quickly reviewing all charts, visually scanning the waiting area, and conferring with the dermatologist. The cellulitis patient, showing signs of systemic upset, was my immediate priority for assessment, OBS, and expediting doctor review. While the doctor saw that patient, I utilized that window to prepare the medication and consent forms for the biologic injection. I then brought the injection patient in, conducted the education session in a calm, focused manner, and administered the treatment. For the stable follow-ups, I organized their appointments in sequence, grouping those needing similar procedures like UVB therapy to maximize the machine's use. I also delegated tasks like preliminary history taking to our healthcare assistant where appropriate. Throughout, I communicated clearly with each patient about minor weights, ensuring they felt attended to. By the end of the session, all acute needs were met, time-sensitive treatments were delivered, and no patient felt neglected. This fluid prioritization, blending immediate risk management with strategic planning for less urgent but important care, ensures both safety and service quality.
How do you handle adverse reactions or emergencies related to dermatologic treatments?
Handling an adverse reaction requires immediate, protocol-driven action paired with clear communication to stabilize the patient and manage their anxiety. My response is rooted in vigilance, preparation, and systematic follow-up. I recall managing a patient who, during their third infusion of a biologic agent for psoriasis, developed acute urticaria and respiratory stridor within minutes of initiation. I immediately stopped the infusion, maintained 4-access with saline, and called for emergency support while activating the crash bell. I administered prescribed intramuscular epinephrine from the prepared anaphylaxis kit, following ACLS protocols, and assisted with securing the airway. My role concurrently involved directing another nurse to alert the resuscitation team and preparing additional medications. Throughout this, I spoke calmly and clearly to the patient, explaining each step. I'm giving you medicine to help you breathe easier. The team is right here with you to prevent panic. Once stabilized and transferred to ICU for monitoring, my focus shifted to thorough documentation of the event, timing, symptoms, interventions, and vial batch numbers, and a root cause analysis with a pharmacy team. I then personally debriefed with the patient and their family once they were recovered, explaining what happened and the new safety plan. This experience led me to champion a quarterly anaphylaxis drill on our ward, ensuring every team member could perform their role seamlessly under pressure. The outcome was a fully recovered patient, a strengthened safety culture, and a refined protocol that included a mandatory 5-minute pre-infusion observation check.